Hi everybody, I'm Dr. Brown. I'd like to introduce you to a friend of ours, Mike Johnson from Napa Valley in California. Mike has suffered for decades with dystonia, tremors, etc. Mike has been through a lot over these years, and when he met us, was it last year originally, Mike?
Yeah, it's been about a year, yeah.
Okay. Would you show the viewers what you presented as when we first met you?
I think I was something like this coming in.
Yeah.
And I was really super shaky, and I felt like I had an ice pick in my back, and that was probably the worst part, is feeling all that pain. Awful.
So Mike was basically diagnosed with dystonia and tremors, tics type things.
Yep.
And oftentimes what's going on in truth is that the discs inside the jaw joints are slipped out of place. When that happens, you're pinching the blood vessels and the nerves in the joints, causing an inflammatory reaction, and the body just gets all perturbed, all upset, and is trying to shake it off, so to speak. Now, when I first met Mike, I told him, look, you might end up needing the surgery to finally fix the situation as best we can, but there's definitely nerve damage, is what I told him, after this many decades of discomfort and slipped discs. The discs were actually on his left side, if I recall.
Yep.
That left disc was in pieces. It was in shards. Imagine years and years of like a kneecap being in pieces, digging into the tissue all around your knee. Life would be very difficult with that, and that's what this young fella experienced for 20
plus years.
Yeah.
Yeah.
So because of that, I suspect there is some damage in the joints. And as you all can see, Mike still has some motion going on, but the head is relatively straight. And by the way, the surgery was only 2 months ago. I can't tell you the countless times we've had a person with tics that it took 6 months to a year for the body to accommodate to the newness.
Just a few weeks ago, I couldn't do this. Okay, like you see it want to jerk around, but I could grab it, put it back into position, make a nice clean left, a nice clean right, back to center, down.
Yeah.
All while breathing. That was not a thing I did right before surgery. That was not a thing that I did when I first met you a year ago.
Yeah.
And to have the ice pick removed is probably the best thing.
Mm.
But even better than that is my wife's joy and happiness seeing me back to normal again. So that's the best thing.
I'm really glad for you, Mike. I think we've made some really good gains. I don't think we'll ever be 100%, but you've improved so darn much. So I think you've done pretty well overall, and we've got a ways to go, but after only 2 months, this is not a bad end result. He can live with this. Now, the flight thing, the back and forth from California.
That beats the crap out of me. You know, just being in that chair with the other seat right in front of you for that long and being jarred around in the plane for 5 hours, it exhausts me. And I get over here and I just have to really take a day or two just to regain all my stillness and my ability to breathe and be calm, you know. I think the big trick in this, you know, when you're traveling around or doing anything, is to really breathe, try to be calm, you know, try to eliminate any weird stress thoughts in your mind. And how Logan Cooper, your pal, always, you know, tells me, ninja breathing, slow breathing.
Absolutely.
You see it all calm down. So I have a lot of hope.
Well, on that note, thank you, Mike. I appreciate your time here.
Thank you. I can't thank you enough.
You're welcome.
And your whole team, oh my God. Thank you guys.
Yeah, I have the best team in the world, folks, and I'm glad to say that. I'm so thankful for every one of them. Thank you.
Me too.